What I want the public to know about the county's focus on mental health and substance use disorder is that we are a resource. The part of the drug crisis here in Sacramento County that I'm most concerned about is certainly the fentanyl crisis, which is one that's affecting all of us across the country. There is a plethora of resources that we have, especially for those that are economically challenged when it comes to their mental health needs and getting counseling around substance use disorder.
The crux of the opioid and the fentanyl crisis, it's not just one area. It's multiple areas. It's the supply coming across the border. It's the cheapness of the drugs. It's the lack of penalty in the laws that we have to really go after these drug dealers. And then it's the new technology. It's the ease for people to obtain the drugs. And it's the lack of education. So there isn't really one thing. It's what you call the perfect storm when it comes to the opioid crisis and the fentanyl crisis. First, you have to attack this from multiple angles. You have to have the prevention, the intervention, the educational aspect of it, where you're getting to the public, whether it be kids, whether it be family, whether it be parents. And then what you have to have is really the prosecution and the interdiction side of it with law enforcement. So it's really all hands on deck to attack this problem. That's what we're doing, the model that we're approaching.
I think the fentanyl issue in our county is profoundly complex, and that there will be an endless supply of fentanyl. And that's not to say we don't do everything we can to go after traffickers and to do interdiction, but you have to do demand reduction. There has to be education about the risks of it. There has to be treatment for those who find themselves falling prey to the drug itself.
Collaboration is key. As I mentioned, it's a force multiplier for us. If we're not all working together, we're essentially only as effective as the limited resources we have. But provided we're sharing resources, sharing information, from the law enforcement perspective, sharing intelligence, we're better able to identify the signs and symptoms, understand at the individual level what's occurring as it relates to our community, but then also on the bigger scale, recognizing sort of the flow into the community of drugs and being able to pursue and generate solid investigative work that results in arrest. But it's not just law enforcement, it's our partners in public health and health, folks that we might not typically think of as our partners. It's community-based organizations, certainly county behavioral health and health services, but also it's community and community taking ownership of the issue.
The things that work in our area, mostly it's education, advocating for policy, helping people understand how addiction is not a choice and how we need to help people, not only with the addiction, not only stopping the drugs, but how do you live without them? That's the bigger challenge.
Solving this fentanyl crisis is not going to come simply from law enforcement. It's not simply going to come from advocate groups or community organizations. This is going to take everybody. This is going to take a change in law. This is going to take a change in perspective. It's going to take a change in focus on, again, penalizing the suppliers and really getting help for those who need it. And that's not going to come from just one entity. It's going to come from everybody.
For what we are understanding in our community about how fentanyl is affecting the overall community, one of the things that is quite telling is that it's very clear that fentanyl is affecting across all socioeconomic status. It is in a variety of neighborhoods. I think because substance use addiction is so strong, and it really is. It's not really within just one culture or group of people or a certain segment of our society. Because of the prevalence, we're really seeing it affecting so many different areas of our overall community and within society.
Our partnership with Sacramento County Substance Use Treatment is just so crucial to these efforts. You know, a safer Sacramento really does look like when we're working together across school districts and county offices and community-based organizations and other partners. For example, being able to bring, you know, a webinar to our parents and our caregivers about the dangers of fentanyl and how to start that dialogue. That was really crucial for us, as well as bringing those partners onto our school campuses to talk with students and be able to provide them education and resources, or where additionally to get help out in the community. It's these types of partnerships that really create that, you know, kind of tight web of safety for our students and our families, and they know that we're here to support them through this partnership, you know, collaboratively.
Approaching the opiate and the drug crisis that we're facing from a compassionate lens of we're trying to help our community and community members by providing them the medicine and the treatment that they need to help reduce their utilization of resources, but also to help them live a better, more fulfilling life, is incredibly powerful arguments.
I'm watching people I grew up with in my community are still struggling. The human suffering is overwhelming, and we are working with everything we have to stop it because our community deserves that.